Raising Kellan Podcast. My name is Marsh Naidu, and I blog at raisingkellan.org, where we curate resources for families experiencing disabilities. Today brings the end to our three-part healthcare affordability series. On episode 168, we talked to Shana Watkins, who is the Director of Healthcare Policy at Tennessee Justice Center. On episode 169, we talked about the CHESS survey, which is the Consumer Healthcare Experience State Survey. Episode 170, which is what we are recording today, is with Kristen Grimm. Kristen Grimm is a human rights advocate and a mother who is committed her life to reforming healthcare in the United States. She is founder and former executive director of Mothers for Medicare for All. This survey was conducted by Altram. Episode 170, which is what we are recording today, is with Kristen Grimm, and has recently accepted a position as the National Director of One Nation Fully Covered as a new and inspiring project of the Tim Carpenter Institute. She believes that healthcare is a human right, and she is here today to talk to us about how she thinks we can get there. As always, remember the content on this podcast is for your information only, and to always do your due diligence and research. So grab that cup of coffee, put your feet up, and get ready for some awesome conversation. Kristen, welcome to the Raising Kellan Podcast.
Oh, thank you, Marsh. It's so good to be here with you, and thank you for being an amazing advocate for healthcare for everyone. So I just want to say that from the very beginning, and thank you so much for having me here today. And thank you so much for doing this podcast. You're teaching all of us, and it's so important that we get the message out about healthcare as a guaranteed human right.
100%, Kristen. And talking about advocacy, as a parent with a lived experience raising my child, I want to say this to parents. Advocacy is never easy, but like a muscle, the more you speak up for your loved one's dignity and care, the stronger that voice gets. And having said that, Kristen, I would really like to find out from you, how did your advocacy work begin, and how has it evolved to where you are at the present moment?
Yeah, I'd be happy to share a little bit about my story. I like to let people know that my advocacy journey began walking the floors of children's hospitals with my son through his childhood and his adolescent years. And he was born with a healthcare condition that caused him to have lots of surgeries. And in childhood, and mostly in his adolescence, he had 25 surgeries. And I really began my advocating for, of course, my son first in his healthcare journey, in our family's healthcare journey, by walking the floors of children's hospitals. And if you have had a loved one who has any kind of significant healthcare, issue in their lives, it doesn't take you very long to know that our healthcare system here and the way that it is funded and paid for is not funded, to be quite honest, because we don't have a national health program. But how we operate healthcare in this country economically is deeply, deeply flawed, a violation of human rights, and deeply complex and horribly difficult to navigate. While parents and individuals should just be caring for their loved ones while they're sick, but they're also navigating this very complex system that is inundated by red tape, whether the individual's on Medicaid or you're just fighting with the insurance companies for the coverage that your child simply deserves because they are human. And so my journey took me from the halls of children's hospitals to advocate in the halls of the state legislature here in Tennessee. I started getting to know about Medicaid and what Medicaid means, not only to the children of the state in this country, because as you know, Marsh, nearly half of all of our children in this nation are covered by Medicaid. And Tennessee's average matches typically year to year our national average. So nearly half of all children in Tennessee are covered by Medicaid. And it didn't take me very long to figure out that we don't have children's hospitals in this country, in this state, without Medicaid. And I remember putting this together when I started being more active and advocating in the state. I'm like, wow, Medicaid built our children's hospitals. And, one of my mentors, Andy Schneider with Georgetown Center for Children and Families, he looked at me one day and said, Kristen, we don't have any hospitals in this country to the capacity that we have them without Medicaid. And that, when I kind of came into awareness and connected that Medicaid equals our children's hospitals, and Medicaid built the children's hospital infrastructure that we had, I was like, I love Medicaid. I just fell in love with it. And so my journey led me from the walking the halls of children's hospitals with my son to the halls of the legislature. And then, my heart just led me to the halls of Congress, right? To realize, as I traveled this state, I got very involved with the Tennessee Justice Center, because once you love Medicaid, you just automatically run into the Tennessee Justice Center here in the state of Tennessee. And I became a volunteer, a very serious and committed volunteer with the Tennessee Justice Center. They taught me so much about the necessary components of Medicaid, but also the beauty of it and why it needs to be protected, expanded, and honestly reformed at certain levels on the state level for how our state legislators advocate and make sure that the program is managed generously and well, right? So after I realized that we probably need some federal intervention, my journey as an advocate led me to the national level. I'm like, okay, we need to reform healthcare at the federal level, because the states were not proving themselves worthy of managing Medicaid. And our state being one of those, as you know, we did not expand Medicaid in this state. Millions of dollars and probably millions of hours were spent by advocates all over the country trying to get these non-expansion states to expand Medicaid. And my advocacy just led me to the federal level, where I just thought, I started learning about Medicare for All, and I got very involved in that movement. As you said, I formed an organization called Mothers for Medicare for All, and got very involved and realized that one of the reasons why we could not get Medicare for All to the floor for a vote, in the House and the Senate, was because we didn't have enough sponsors. And so I went on a mission to try to get more sponsors for Medicare for All. And I stood in front of a congressman's office, Representative Jim Cooper. He's no longer a member of Congress, but I stood in front of his office for 19 Fridays, asking him and pleading with him to sign on to Medicare for All. And then the pandemic happened, and, we weren't able to stand in front of his office, but we stood as mothers. We had physicians standing with us. Other organizations like Physicians for a National Health Program stood in solidarity with us. And we stood out there from 8 in the morning till 5 in the evening every single Friday. And we did that for 19 Fridays. And we stood out there in the snow and the rain. And so my advocacy journey just became, we've got to reform healthcare in the United States. So my lived experience took me to all kinds of hallways, but it also took me to the people of this state. So when I was traveling with the Tennessee Justice Center and getting involved in my own community here in Williamson County, which I live in Franklin, Tennessee, I started recording and documenting the stories of individuals who had gone without health insurance for decades. And I started making calls for the Tennessee Justice Center, documenting those stories, those gross violations of human rights. And the stories that I collected and recorded still stay in my heart everywhere I go. And the people that I held space with, the individuals that I helped get Medicaid through disability, through SSI, it was one of those propelling experiences in life that just says, this is my life's purpose. One of my callings in life is to reform healthcare in the United States and make sure that healthcare is a guaranteed human right. And I would like to say just quickly that guaranteed human rights is a policy choice.
It is.
A national health program is a policy choice. Medical debt is a policy choice. And one of our dirty little secrets in this country is that every day, families are sent to collections by children's hospitals in this country. Now, it's not because children's hospitals like sending parents to collections, but there are parents all over this country who are in medical debt to children's hospitals. And that medical debt is a violation of human rights. And it's horrible what we do to doctors and what we do to children's hospitals. They don't want to send no children's hospital in the country wants to send a parent to collections. My biggest dream is that we will incrementally start to reform healthcare a little bit at a time. I believe that one of those ways we can do that is insuring all of our children. And as you know, we've talked about this several times, the idea to have a Medicaid for All Children Act in Tennessee. The amazing thing about putting all children on Medicaid is that we are already almost halfway there.
We are.
Yeah, we're almost halfway there. And it's possible and it's feasible and it's doable. A lot of people might bring up the fact that, not every provider will take Medicaid. And there's a provision in the bill that addresses that because we want to make sure that all service providers are paid fairly and equitably. And right now there's an imbalance for what the providers are paid for in the difference of a Medicaid reimbursement and a Medicare reimbursement. So all Medicare reimbursements are at a higher reimbursement rate than Medicaid. And so in this piece of legislation, the reimbursement rate on the state side, we make amends for that. We go ahead and make provisions for that so that all providers are reimbursed at the Medicare reimbursement rate. And, the pediatricians that I've spoken to about this are like, okay, well, that's amazing. There's pediatricians get into this, into medicine because they love kids and they want to help kids and but there's also some pediatricians can only take 4 or 5 or 6 or 10 patients on Medicaid because they don't have the time for their staff to fight with the reimbursements, to fight to get reimbursed from the Medicaid program, which is called TennCare in the state of Tennessee. And a lot of those reimbursement challenges are through our MCOs, which are managed care organizations. And we have multiple insurance companies that are responsible for managing Medicaid. So in this, what I like to call the MACA bill, the Medicaid for All Children Act, all insurance companies are just going to be eliminated from the program. We're going to take them out. And we're going to remove them from the from the profiteering off of our state, and they are unnecessary. And we are going to restructure how Medicaid is managed in this state. And we're going to put it back into the hands of the state, and we are going to have just a very sound program that is eliminating waste in a program that should be here to serve the children. The other amazing piece of this legislation is that we're going to eliminate all means testing. So every child, regardless of the income of the parent or the caregiver or the guardian of the child, there is no redetermination requirement. So just for your listeners, when individuals are trying to see if their children are eligible for Medicaid, you have to go through an income eligibility determination. And so you have to fall somewhere, within the thresholds of income eligibility, and we're eliminating all of that. And I have heard so many stories, and I have held space with so many parents who made just $200 too much in 1 year. And, they work really hard. They're trying to, make extra money. I have a story of a single mother who she was working a full-time job and getting an extra job. She had 3 small children, and one of her daughters needs a surgery every single year just so that she doesn't lose her eyesight and that she can keep her eyes open and actually see. So we're talking like a profound need for a surgery every single year. And she made a little too much 1 year, and she lost Medicaid for all 3 of her children. And it caused a panic. And I will never forget holding space with this mom. I met her at the library, and we were sitting in this little conference room, and she was just in tears. And she's like, my daughter has to have this surgery or she won't be able to see. That is just one story of so many where parents are watching every single penny that they make. And how hard is it, on the finances of a family to say, I can't even make extra money or my child will lose health care. Beautiful things about this legislation is that no parent will ever lose Medicaid for their child again in the state of Tennessee, and they won't have to get redetermined every year. And that stress is going to be eliminated. And one of the most exciting things, other than all of our kids having coverage, is that we are going to eliminate medical debt for all children in Tennessee.
When you talked about medical debt previously, I actually kind of just smiled because it took us 5 years to pay one of Kellan's surgeries off. And medical debt, as well as meeting deductibles and co-payments, is a stumbling block. Insurance there's no translation of risk. I mean, you are holding the risk, you are paying the premiums, you are paying the co-payments, the deductibles. I mean, you are assuming risk, and that's not what insurance is, Kristen. And on top of that, you also are weighed down by the administrative burden. I can't see why anyone wouldn't want kids to have health care.
Yeah, and it's to us, it just seems like the most beautiful heart space, and a beautiful heart space for a loving community of concerned individuals who live in the state of Tennessee, where we would all want healthcare for all of our kids. And that I can't imagine meeting up with someone in the state where they would not want a child to go without an asthma inhaler, on the weekend. But I've heard of situations where insurances were not covering asthma inhalers. My own asthma inhaler just a couple of months ago was not covered by my insurance. I had to pay out of pocket. And there are families who go to the drugs, they go to the pharmacy, they pull in the drive-through, the prescription for their child has been called in, and all of a sudden the pharmacy says, hey, your prescription is not being covered by insurance. That is a violation of human rights to allow the capitalistic insurance companies to profit off of our state and the people of this great state of Tennessee, and to deny a child an asthma inhaler, to deny a child of any medication that a pediatrician that says this is a necessary medication, this is a necessary surgery, this is a necessary test that this child needs, to allow an insurance company to have autonomy and authority over the doctor or the provider that says, yes, this child needs this specific, service or medication to get well. We're eliminating those insurance companies. They should have no say in our healthcare system at all. And they are the reason, they are the main reason why healthcare is not affordable, why healthcare as we are doing it is not sustainable in this country, is a for-profit motivated system that we have at this present time. And so I always think that, you should eliminate the source of the problem, and that's what we're going to do. And we are taking that idea from Medicare for All, because in the Medicare for All legislation, they completely eliminate the MCOs. And that's how the program is feasible, and that's how it pays. It pays mostly in part how it pays for itself. And so it's just it's all very exciting. And I agree with you. I believe that the vast majority of Tennesseans really believe in their heart that children deserve health care coverage seamlessly, and they deserve to get the health care that they need. I mean, I've never met anyone who has said, I'm just not a fan of children's hospitals. Have you?
No,
I have
I haven't.
never met, or I've never I don't like children's hospitals. No, it's like there's just something in our country that loves children's hospitals, because I believe that collectively we care about kids and their health, and we care about children's hospitals. And so I always tell people, especially lawmakers. I saw a lawmaker in an elevator, and of course, when I go up to this state legislature, I always wear a button on my jacket that says, I love Medicaid. And so I get in an elevator with lawmaker, and he is just looking at my button. He's like, so you love Medicaid, huh? And I said, I do. He's like, huh? And he wasn't sounding like he loves Medicaid. He was kind of looking at me, groaning like Medicaid was a big thorn in his side. And I said, do you love Medicaid? He goes, I wouldn't say that, I wouldn't say that much. And he said, not really, And I said, well, let me ask you this. Do you love children's hospitals? And he's like, well, yes, of course, And I said, well, then if you love children's hospitals, you love Medicaid. And it's just true. And so how do kids get to children's hospitals? Well, they go there and they get their needs met. But if they don't have the money to pay their bills, they end up with medical debt. And my dream and my vision for every child in the state, and my dream is this for all of us one day, but incrementally, we're going to start here in Tennessee and hopefully take this to every state in the nation, that no parent would have to think twice about taking their child to the emergency room in the middle of the night because they're worried about medical debt. They don't have the money for the copay. These are true stories that happen all over this country. That, if you have medical debt to a children's hospital, you might think twice before you take your child to the emergency room. You might delay. And it's not that you're not a good parent. You're like, okay, well, what can we do here? That is primitive thinking. It is wrong. It is wrong that we even put parents in a position to think like this. And we are a nation that is in gross violation of human rights at every turn on so many levels. But this is an egregious violation of human rights. And I always like to tell people one of the policy failures of the Social Security Act of 1935 was that the Social Security Act of 1935 was supposed to have a national health program in it. And it was left out, and it was lobbied out by the AMA, the American Medical Association. Mm-hmm. And we have been fighting over this issue of guaranteed health care for all since before the Great Depression. And we are still arguing it about today. And as we argue and as we delay and as we deny human rights to every human being in this country, healthcare just gets more and more expensive every day.
And our health outcomes don't match what's being spent on healthcare either.
But the thing is, with all of these statistics and all these things that we hold in our hearts as advocates, because we know the statistics and we share them as often as we can, there is a solution to the suffering of the people of this nation. And I believe that we can get there. And I used to be a purist. I didn't want things to happen incrementally. But one of my mentors, Andy Schneider at Georgetown Center for Children and Families, he's like, Kristen, we need people with your passion. But he said, I am an incrementalist because really, in truth, that's how things change. And I fought it. I was in Washington, D.C. at a healthcare conference at the Georgetown Center for Children and Families annual conference. And I just, I didn't want to agree with him. But as I have matured, I have come to see that advocacy is a daily commitment. And we do make incremental strides. And I believe that over the course of my advocacy journey, I've realized that there has been a little bit of a separation between the Medicaid advocates and the Medicare for All advocates, because Medicare for All gets rid of Medicaid in the actual legislation. And it's really hard to support legislation when what you're doing every day is just going to be eliminated one day. So I'm a pragmatist. And I'm like, how can we get these two amazing groups of human rights advocates together, the Medicaid advocates and the Medicare for All advocates? And I believe one of the ways we can do this is starting with our kids and put all of our kids on Medicaid. And my vision for healthcare reform in the country is put all of our kids on Medicaid because everybody already understands this. It makes sense. Most people, if you really explain to it, so TennCare is Medicaid, like in California, it's Medi-Cal. The bottom line is like every state has its own name for Medicaid. And when you explain what it is, people understand, oh, yes, a lot of kids are on Medicaid. And so it makes sense to put all our kids on Medicaid, put all of the adults on Medicare, and so there's seamless transition. It will make it easier for the children's hospitals because the children's hospitals and the PCPs and the providers for children's healthcare, they kind of already understand the Medicaid. And one of the things that one of my son's surgeons said, please reform healthcare in the United States. He said, because my nurses spend so much time fighting with insurance companies for permission and to get things covered and to get approvals for surgeries, for tests. And some of his nurses that I got to know very well over the years, because after 25 surgeries, you get to know your specialist and your specialty care team very well. Some of those nurses, because they were on the phone with insurance companies during the day, they're in the office until 9 p.m. sometimes, catching up on paperwork. And this isn't fair to our physicians and the nurses and the staff that serves the children. And so I was just like, what if we eliminate the MCOs? What if we eliminate the insurance companies? It's like, if you could eliminate insurance companies and make sure that we reform healthcare in the United States, it would change children's healthcare in radical ways. One, the physicians and the nurses would have more time to see more children. So your wait times are going to go down and they're going to have more energy and more, just so much more time to be with their patients. And so there's so many benefits to covering everyone, reorganizing how our system works. And so everyone benefits from having everyone covered. And so One Nation Fully Covered, you mentioned that earlier, is a new initiative that I've been hired to head up a program under the Tim Carpenter Institute. And it's just an honor of a lifetime to follow in the footsteps of Tim Carpenter. Tim Carpenter was an amazing just a brilliant advocate for healthcare as a human right. And he was talking about it long before it was cool. And I'm so honored to carry the torch that he carried throughout his life. Tim passed away, I think in 2004 or 5, and he gave his life and his heart and soul to reform healthcare in the United States and to call on our elected officials to support universal healthcare systems. And if you did not support it and you said that healthcare is a human right, he was after you. And he was after you with all his love. And he had a passion for reforming healthcare in the United States and reforming political systems as well, because the political system is the reason why we don't have a universal health program in this country.
Yep.
Make no mistake. Our violation of human rights in regards to healthcare is a policy choice. And I know I've already said that, but I've got to say it again. Andy Snyder's so right. It's really how change happens, a little bit at a time. And you just wake up and you do the best you can, and you fight with all your love, and you give it your best every single day. And you change the things that you can change, and you have an open heart for learning and expanding. My heart has expanded for how I believe healthcare should be reformed in the United States. We are building this movement one beautiful day at a time, and it's going to take all of you. And if anybody is wanting to sponsor a I Love Medicaid billboard in your county or in your town, certainly reach out to the podcast and say, hey, I heard your podcast, and can I get connected with Kristen? And I'm sure you'll connect us until we can get our social media up. But yeah, we're looking for people to sponsor those billboards. That's a big dream of ours, and it's certainly a goal that we will hopefully see happen very soon. So
thank you so much, Kristen. You have a great evening, and we'll talk soon, all right?
Sounds great. Thank you so much.
Thank you for listening along on the podcast today. Remember, Kristen's work is under the auspices of the Tim Carpenter Institute, and it is called One Nation Fully Covered. It would be awesome if you could listen to episode 147, which was an interview with Leo Coelho, who is with George Washington University. And in this episode, he explains what Medicaid is and the services that it covers. As always, thank you for listening along on the podcast. If you have any questions or you would like to contact us, we can be reached at Raising Kellan, that's spelled KELLAN, @gmail.com. We would appreciate a rate and review of this episode. And this week, I got to actually record about the healthcare affordability series with Yonder Radio, and that should be airing in about 2 to 3 months' time. So watch out for that as well. As always, get to the top of your mountain. This is Marsh Naidu signing off.